Good afternoon, and welcome to today's version of the Black Health Trust. I was speaking to one of our expert consultants, and he told me that he recently, last week, got on a plane flight to New York, and somebody was coughing, and he is now deeply ill with COVID, even though that is his area of expertise. And he said he's never felt this sick. So we know that COVID is back. The dangers are still there. And when we first started, we devoted a lot of our time to the issue of COVID-19 and how people should distance themselves by at least 6 foot, to wear a mask to protect the other person, to cleanse their hands, and to watch the way that they touch materials, to keep their hands out of their eyes and mouth, and to take Paxlovid preemptively within the first 5 days of getting symptoms from that, and to maintain vitamin D levels and use vitamin C and try to make your immune system as active as possible. So we're going to have some of our experts on COVID back soon, but make no mistake, this COVID is not gone. And we also know that during the summer season, we have new strains of influenza out and new strains of new viruses out for pneumonia. So please take care of yourself. Make sure you're following the protocols that we've spoken about. And we'll keep reminding you every week. Use common sense and take care of yourself. And if anybody tells you different, ignore them. Please do. Another continuing problem, especially among people of color, is that of high blood pressure and strokes in particular. And our topic today is going to review some of the issues around stroke and how to avoid that if you can. Let's roll, Simon.
Hold on just a second. Get us started. Good afternoon, everyone, and welcome to today Black Health Trust. Glad you all could join us, and I'd like to turn the program over to our founder, Dr. Randall Maxey.
Good afternoon, Dr. Walks and Dr. Hines and Simon, all those who joined us today. We're going to talk about stroke. We've talked about it before, but as Dr. Walks told me earlier, people are still having them, so it's something very relevant. And we'll entertain questions and answers after the talk, and we'll start. I want to just announce that one of our preeminent pastors and civil rights advocates in Los Angeles passed the other day, Reverend Dr. Chip Murray, the pastor of First AME Church. And he was a great, great leader and friend and man. And we do mourn his passing. So it seems as the older I get, the more people I know that pass. I don't know what the psychology of that is, Dr. Walks.
I don't know, Dr. Maxey, but you mentioned Reverend Murray. He was a good friend of our family and actually read the scripture at my dad's, Reverend Walks's funeral. So Reverend Murray is someone I've known for many, many years, and much, much respect for the work that he's done really to transform that community where he served for so long.
Oh, very good, very good. I didn't know you were a PK.
You can't tell?
Okay, Simon, let's go with the first slides and start. You going to play, Simon? Looks like we're having a little technical difficulty a minute. Okay, we got the wrong thing up. It'll be up in just a minute.
So one of the things from what was just shown, Dr. Maxey, it's just every time we talk about one of these conditions, there's always that part that we read that talks about how it impacts the Black community in a way that is profound, and another reason for us to talk about it again.
That's true. Thank you.
And just to add to that point, I think in addition to the fact that, you know, it stays relevant, there is still that space where people don't recognize or acknowledge some of the symptoms of a stroke. And that's so critical in the context of trying to get care or treatment for a new or acute stroke. There are sometimes there is something that can be done if we act fast. And it's very common for people to want to, oh, I woke up with these weird symptoms, right? And then, oh, what if I lay down and I'll go back to my room and lay down and take a nap, and then maybe it'll be better, or I'll just sit here and, you know, give it some time. And sometimes that precious time is the difference between something that we can act upon and something we can't.
You don't want to wait. I invite my co-moderators, as we usually do, to comment on the information that we present, and then we'll look at some of the other subjects. So stroke is a very important topic, both in terms of public health, and I'll have to say, and also personally. So let's go to the next slide, please. So heart disease is one of the leading causes, along with stroke, of mortality and morbidity in the United States. There are 7 rules of life. Next slide. And this could encompass the whole talk. Stop smoking if you do. Eat better if you don't. Get active if you are not. Lose weight if you need to. Manage blood pressure. And control your cholesterol and reduce your blood sugar. And up to the weight thing, we know that there are cultural differences in weight. And we know that some 80+% of Black females are obese, and probably only a slightly lesser number of Black males that are obese. And it's not because of so-called big bones that we don't eat correctly. Next slide. So stroke is the 5th leading cause of death in America. When the blood that brings oxygen to the brain stops flowing, brain cells die. On the average, someone in the United States has a stroke every 40 seconds. Black Americans have a higher prevalence of stroke and the highest death rate from stroke than any other racial group. Eating too much salt, which is sodium. Research does show that African Americans may have a gene that greatly exacerbates our sensitivity to salt and its effects. Next slide. So, stroke reduction. So since stroke is a leading cause of morbidity and mortality in North America, we know that primary prevention of stroke includes lifestyle modification and measures to control blood pressure. Cholesterol levels have to be controlled. Diabetes mellitus, if you have it, needs to be controlled. Blood sugar, even if you're not diabetic, needs to be controlled. And there's a condition of the heart beating too fast called atrial fibrillation that needs to be identified and if found, controlled. But lowering blood pressure in patients with hypertension is significantly important in both types of strokes. There's one kind of stroke called a hemorrhagic stroke, which is a blood vessel bursting and bleeding in the brain. And the other is called an ischemic stroke, where a blood vessel becomes blocked. But treating these 2 types by lowering your blood pressure and keeping your cholesterol and glucose under control can reduce strokes by 30 to 45%. Next slide. So what is a stroke? A stroke is sometimes called a brain attack. It occurs when something blocks a blood supply to a part of the brain or when a blood vessel in the brain bursts. In either case, parts of the brain are damaged or die. A stroke can be can cause lasting brain damage, can cause long-term disability, and it can even cause death. Next slide. In this set of cartoons, on the left you see a blocked artery. And in that blocked artery, the area of the brain below the blockage can die. It's called necrosis. It's called an infarct. And that is a type of stroke that can be quite damaging. It can typically be caused by either a blood clot being there, or it can be when a blood vessel is blocked by plaque, which is high lipids in some cases. And it can even be temporarily blocked for less than 36 hours, and then it's called a TIA, or a transient ischemic attack. Number 2 is a ruptured artery, which has caused a bleeding stroke or a hemorrhagic stroke, and it shows that below the area of the bleeding that you also have necrosis of brain cells. Next slide. So there are risk factors. The higher levels of cholesterol are associated with an increased risk of ischemic stroke. We used to call it hardening of the arteries. It's atherosclerosis. It's plaque. Because anything that can narrow the lumen in the blood vessel leading to areas of the brain. If you have high cholesterol, you should be treated with statins or some other agent that can reduce the risk of having high cholesterol. There's a lot of controversy over, I don't want to take statins, but sometimes those statins can save your life and can reduce fatal strokes and non-fatal strokes by up to 25%. But pairing glucose control with stroke reduction and aggressive treatment of hypertension and hyperlipidemia in patients with diabetes mellitus is recommended. There was a study done some years ago showing that if you have diabetes and you have to control both glucose and blood pressure, it is more important, even though they're both important, that you control your blood pressure aggressively. There's more life-saving events with control of blood pressure. Next slide. So strokes can happen to anyone, but they tend to be more common in older men, Black people, and Asian people. So reducing your risk to stroke or for stroke includes avoiding tobacco use, taking care of high cholesterol levels, get rid of that fried chicken and ribs, and also having an active lifestyle. Next slide. Get your blood pressure checked regularly. That's very important to do that. We have a project right now called RPM, Remote Patient Monitoring, where we can provide people with blood pressure monitors, scales, glucometers, and oximeters, but we can collect that information and provide you with information on how to keep your blood pressure under control remotely. You should avoid smoke and avoid people who smoke, and don't allow smoking in your house because secondhand smoke is sometimes more dangerous than firsthand smoke. Eat less fatty foods. Have your cholesterol levels checked regularly by your family doctor. Exercise regularly, at least 30 minutes on most days of the week. Keep your weight under control. If you have diabetes, control your blood sugar. If you don't have diabetes, control your blood sugar. And that example I've given before about creme brulee, where your high blood sugar gets converted by your normal body temperature into a plastic-like spicule that goes into your blood vessel and can cause plaques and blood vessel damage. Next slide.
Dr. Max,
Yes.
Dr. Maxey, there has been a question asked about cholesterol. How do you know that your cholesterol is high, and what is HDL and LDL?
Okay, so the way you know your cholesterol is high, in a normal sense, you have to have your blood drawn, and your doctor will order something called a lipid panel. In that lipid panel, there are several sets of elements that we will talk about. One is your total cholesterol, which should normally be below 200 milligrams %. Then there is your good cholesterol, which is HDL, and HDL should be above 70%, and HDL helps get rid of your bad cholesterol. Your bad cholesterol is called LDL, and LDL needs to be less than 100 milligrams %. And then they are your triglycerides, and we can discuss some of those as we go on. But you can't find out your cholesterol unless you have your blood drawn. Unless you have severe elevated cholesterol, in which case you form these little things that turn up at the corners of your eyelids, etc., called atheroma. And that's when you're really out of control, when you have fat deposits in your epidermal tissue. And we can talk about those as we go later. Now, none of us like to take medicine. But if your exercise and your diet control are not taking care of your high blood pressure your high glucose or your cholesterol, you may have to take medicine. And that's what your medical provider or your physician can prescribe for you. And I do ascribe to the fact that you may have to take medicine. You may not have to take it lifelong, but you might need to take that medicine until you get under control where diet and exercise can adequately control it. So if you do have high blood pressure and diet doesn't control it, you need medication. Now, I give some personal recommendations that there are many types of blood pressure medicine. I advocate that the type of blood pressure medication taken by African Americans not be so-called ACE inhibitors, because one, they weren't researched on people of color. There's also more allergic reactions. And I think it's better to use something called an angiotensin receptor blocking agent, usually drugs that end in the word sartan. And they help also lower the effects of high blood pressure on your kidney by reducing pressure inside the glomerulus. There are also medicines called calcium channel blockers. And the one type of medicine that I advise against in most cases as a first-line drug is something called beta blockers. And we can talk about that later. And I have some interesting personal experience with some of these. We know there's controversy about anti-cholesterol medications, but if you need it, it might be good to temporarily take it.
Dr. Maxey, I hate to interrupt, but you've mentioned high blood pressure and lowering your blood pressure several times. And for some of the psychiatrists on the call, can you tell us what a normal blood pressure is and what it means when you say high blood pressure? What are those numbers?
It's 120/80, and I've got a slide just for you in a few minutes.
Okay, thank you.
Okay. And so it's important to know that sometimes people need to take blood thinners. It was recommended years ago that people take 81 milligrams of aspirin a day. That's good for some people, but there are risks involved. So make sure you have an idea from your doctor or provider whether that's something that's good for you. And also has an effect in some people on helping to lower the risk of colon cancer. Next slide.
Could I just underline what you just said about consulting your physician about whether or not you are a candidate to take aspirin therapy? The guidelines on that just in the last couple of months have been changed, and it is no longer recommended that people 60 and older take aspirin for prevention of problems. And it is, again, really important that you discuss with your physician whether or not, if you're younger than 60, whether or not you should or are a candidate to take aspirin. Don't just go to the store and start popping pills.
Right. And there are other advantages of aspirin other than just high blood pressure and stroke, et cetera, but that's beyond the scope of what we're going to talk about today, but you're exactly right. So antithrombotic therapy and antiplatelet therapy or anticoagulant therapy, and I won't spend any time on that, but that's something you're only going to talk about with your doctor anyway. Next slide. So you're going to see me talk about high blood pressure much on this thing. High blood pressure is the big silent killer, and it affects a lot of us, and you don't know if you have it or not in most cases. Diabetes is the other one. And heavy alcohol use is probably not that prominent on the audience that we have on this call, but the drinks that you have are very important not to over drink, and nobody should be drinking a fifth of liquor per night. And I was always taught that whatever a patient tells you that they drink, multiply it by 5. Next slide. Is that right, Dr. Walks?
I don't think that's an absolute, Dr. Maxey, but I think with some people, you may want to do that.
So I had this slide specifically for you, and I put a note to myself to have Dr. Walks navigate this slide verbally for us.
Oh, I'm happy because reading is fundamental, Dr. Maxey.
Thank you.
So this slide, do you have high blood pressure, or how do you know if you have high blood pressure? Well, blood pressure categories we have on the left, and then the upper number, the systolic number we have. And blood pressure always comes in 2 numbers. People will say something to me like, well, you know, my blood pressure is 100. No, it's not. your blood pressure is always two numbers. And so when we're looking at this slide, it tells us normal blood pressure, the top number is less than 120 and the bottom number is less than 80. So Dr. Maxey mentioned earlier, normal blood pressure, 120 over 80. Great. Then we have elevated and high. And thank you, Dr. Maxey, for making this slide easy for me, because I can tell this is like one of those weather reports. When the color gets down from orange and red, it's time to get in the basement. And so with this slide, it's time to run to your doctor. And there are actually stages in this where it says consult immediately. So elevated blood pressure, 120 to 129, but still the bottom number is less than 80. High blood pressure, both the upper number and the lower number are high. 130 to 139, 80 to 89 on the lower number. And then we get into this is some real concern. High blood pressure, stage 2, 140 or higher is that upper number, and 90 or higher is the lower number. And then hypertensive crisis, where you've got to really get some help quickly. Upper number is higher than 180 and lower number is higher than 120. This is a great slide, Dr. Maxey. It's very clear, but when I just get off the treadmill, is that the time that I take my blood pressure? I've just finished doing my 4 miles and I'm sweating and I'm breathing really hard. My heart rate is up and I'm feeling really healthy. That's not when I take my blood pressure and look at these numbers, right?
No, but let's talk about that. That is an excellent time to know what that blood pressure is after you get off that treadmill, because your blood pressure is evanescent. It is meaning that it does not just stay 120 over 80, even if you're perfect. Your blood pressure is going to go up and down with emotion, with activity, etc. The way I check blood pressure, I have a person walk in place for 2 minutes in my office. And if that blood pressure exceeds that level, the second level where it says elevated, then I know that they're not properly controlled. After you exercise, after you walk, your blood pressure should not significantly go above that elevated level. Should not do that. You need to be controlled much more than that. And the only way to tell is to challenge the blood pressure. So you can be sleeping in the bed and your blood pressure is 120 over 80, but if you walk to the kitchen to eat that bacon and it jumps up to 130 over 139, that's high. That means you're not controlled. So you have to take your blood pressure, maybe not exactly after you get off the treadmill, but within 10 to 15 minutes after, it should return to normal, if that answers your question. So
let me just be clear, Dr. Maxey. So no matter what I've been doing, if I sit down for about 10 to 15 minutes, my blood pressure should go back down to these levels.
Yes. Okay, because if not, imagine that what your blood pressure is doing when it's higher than that, it's like hitting your head against a wall softly at 130 millimeters of mercury per minute. That will give you a severe headache. That can burst a blood vessel. That can exacerbate the release of a plaque. So that blood pressure is very important to be controlled most of the time. It won't be controlled all of the time, but the majority of the time it should not go above that elevated level. Let's go to the next slide, Simon, if you would. Atrial fibrillation is something that your doctor will tell you if you have, but if you feel abnormal heartbeats, for example, when I do a pulse, if your pulse rate is 130, 140, if I hear abnormal beats, I'm going to do an EKG. But ask your doctor. If you feel your heart flipping and flopping in your chest, you need to be checked with an electrocardiogram. Let's go to the next slide. And we'll talk about extracranial, but many people have strokes related to what's going on in the carotid artery. That's a big artery in your neck where you can feel your pulse in your neck. And some people have stenosis. When your doctor examines you, not only should they listen to your heart, but they should listen to your carotid, because sometimes you can hear a murmur there or sounds there that would indicate that you have carotid plaques. And the way you test that is with a Doppler or an ultrasound. And that's something your doctor can do, and you should do that. Next slide. Intracranial stenosis, you're only going to find out if you have an MRI or MRA, and that would be a test that your doctor can order, and the appropriate therapy will be ordered from that. Next slide. So there are several studies that evaluate secondary stroke prevention, and there are some people who don't have, there's usually when you're born, there's a hole in the heart between the two atria called the femoral valley, and normally that closes after the first 4 breaths or so. Is that right, Dr. Barber? The first 4 breaths that you have, it closes?
It should.
Okay, but in many cases, some cases it does not, and you find some adults who have persistence of that into adulthood, and sometimes it's found and it can be closed percutaneously. But again, you can find that out when your doctor does an evaluation, usually with a 2D echocardiogram or a color flow study of that. Next slide.
So Dr. Maxey, so just to clarify, the foraminal valley is an opening that connects the 2 sides of the heart that we don't need after the baby is born. Is that
Correct.
fair to say in layman's terms?
Correct. And if I'm right, then I'll defer to Dr. Barber, that in utero, this allows the baby to have directly high oxygenated blood to the brain in utero. But after you're born, you don't need that. Any comments on that, doctor?
That is exactly right. And if things go the way they're supposed to go with those first breaths, the signal is given and it's supposed to close. But a lot of times it doesn't.
So
It's
having
not an uncommon finding, actually.
having a healthy baby is a miracle, I'll tell you. Patients with embolic.
Nature knows what it's doing.
Okay, I think nature's name is also God. Patients with embolic stroke, which is a stroke from blood clots of uncertain source, should not just be willy-nilly put on an anticoagulant. And also, when you go to an emergency room with a stroke, which I'll talk about a little bit, you have to be careful about whether or not you want to receive the clot buster. And I'll talk about that in a minute. Let's go to the next slide. So what are the signs of a stroke? If you see facial drooping or experience facial drooping, if there's sudden numbness of the face, one side or the other, or unilateral, meaning on one side of the hands or arms or legs of numbness, if you have arm or leg weakness, if there's speech problems or even understanding problems of comprehension that's sudden in onset, or sudden onset of lack of balance, lightheadedness or dizziness, it could potentially be a stroke. Next slide. So in those cases, you want to call 911. If someone shows any of those symptoms, even if they go away. So she had it at 8 in the morning, she ate some breakfast and it all went away. Call 911 still. And try to get the exact time that the symptoms were first noted. So when you go to the emergency room, you know when the symptoms happen, because there's a clock ticking, there's a time limit in which you can be offered a clot buster. And I believe that window is about 5 to 6 hours at most. And sometimes that can be life-changing if you get the clot buster. I'm not using the appropriate pharmacological name, but it does save lives if it can reduce that clot. But there are also risks with taking it. And you must ask that radiologist, they have specific radiologists who read those, and make them tell you, if you have a risk, what is the possibility that the blood clot buster will work and provide you with relief, and what is the specific risk if it doesn't, and what is the percentage? Compare those two percentages. And I've seen people go to the emergency room, they said, well, there's a 20% chance that it will make you better and a 40% chance that you will be worse. Then the answer is no, I'm not taking it. But if it gives you the right recipe of what the risks are, then you should consider taking it in consultation with the primary care doctor. There are 5 suddens that cover stroke warning signs, such as sudden numbness or weakness of the face, arm, leg, especially on one side of the body. Next slide. Next slide. If there's sudden confusion, trouble speaking or understanding, sudden trouble seeing in one or both eyes, sudden trouble in walking, dizziness, loss of balance or coordination, sudden severe headache with no known cause. If you think you or a family member may be having a stroke, call 911. Acting quickly can improve the chance of survival, improve the chance of recovery, and the doctor will do an exam and order tests, including pictures of the brain, and probably offer you, if you've been in that 5 to 6 hour window, of whether or not the clot busting injection will be of use to you. Next slide. So risk reduction, I coined the term HERO, Health, Education, Risk Reduction Opportunities. And what we do here on Black Health Trust is HERO, Health, Education, and Risk Reduction Opportunities. The management of vascular risk factors remains extremely important in secondary stroke prevention, meaning if you've already had a stroke or a TIA, but it's not limited to that, but it's important in diabetes, smoking cessation, lipids, and especially high blood pressure. And intensive medical management is often performed. And this is important. It's not just giving people a brochure, but actually having a program that you attend to decrease your risk. Next slide. And I use that term demographic at the end of that sentence. Everybody is not at the same risk. We know that there are lifestyle factors, including healthy diet and physical activities. They're very important. We recommend a Mediterranean diet or a DASH diet recommended for stroke risk reduction. There's a product called Mrs. DASH, and that's a diet to lower the risk reduction. It substitutes for salt without having any sodium in it. Next slide.
Dr. Maxa, you mean the Mrs. Dash seasoning that you can just buy in the grocery store, right?
Yep, and they have all sorts of flavors. They have garlic and they have regular, and I have it on my table.
And it's right in there next to the regular salt and the seasoning salt and all that.
I think so. I haven't been shopping for a while, but I think that's where it is. But it's delivered at my house. So changing patient behaviors, such as diet, and that is so difficult for a lot of us, including me, that we have to look at this diet, we have to look at exercise, and I almost call this lecture the beat up, because I'm repeating so many things that are so important. A lot of this can be handled by diet and exercise alone, and not all necessarily fancy medication. Next slide. So there's some nutritional suggestions, and I got this from nutritionists that I work with, to limit your total carbs to 30 grams or less per meal. Increase fiber to 25 grams per day for female, to 40 grams if you're a male. Avoid processed and refined foods. Center meals around 3 to 4 ounces servings of protein. Dr. Cutter, a few weeks ago in her talk on nutrition, said we should use our meat or fish and protein as a condiment and not the main part of the meal. So don't build a meal around the steak or the fish, make those the condiments. Eat 1 starch a day. Fresh fruits at least once per day. Vegetables at least 2 with dinner or lunch. Fresh salads 3 to 5 times a week. Choose organic produce, grass-fed meats, wild-caught salmon, pasture-raised chickens, and eggs. Next slide.
Dr. Maxey, before you leave this slide, can you just say starch is potato? Tell us about what a starch is quickly.
Starch is potato. It's pasta. It's what they call long chain, branch chain carbohydrates. But there are things
bread.
And bread.
And those of us with the Caribbean background, you trying to limit our rice also?
Oh man.
I'm
Rice,
just saying, I'm asking these questions.
you're right. So I'm in a Jamaican household, and rice is a part of every meal. At least they try to get it. At least they made it brown rice now.
So all the things that you just listed, I just want to be clear. So the rice, the pasta, the potatoes, all of that stuff we have to pay attention to,
And the grits.
and the starch.
And the grits.
No, we're gonna exclude grits. You can't get rid of grits. Next slide. No, grits should be out. Next slide. So everything that's good to you should be out. You should. This is get rid of go to the next slide from this. So RWM, that's Randall W. Maxey Gourmet, comments. Roasting vegetables on high heat will sometimes caramelize them and reduce the bitterness, but you don't want to caramelize them too much. That has some effects on possibly being carcinogenic. Grilled fruits will unlock deeper sweetness. Marinating mushrooms and other vegetables in low-calorie salad dressing like Italian dressing, lemon garlic dressing for grilling is also excellent and healthy. And my dinner tonight is going to be mostly vegetables and a little bit of fish as a condiment. Next slide.
Dr. Maxey, before you leave this slide, you mentioned low-calorie salad dressing. So many times folks will think they're eating a healthy salad and they've just poured 500 calories of salad dressing on it.
Well, I should put a limited amount.
Well, there is no excuse for that because salad dressings are very simple to make yourself. And you can certainly make a low-calorie Italian with a little vinegar, a little olive oil, and some Italian seasoning, and you won't have your carbs. So we need to get back to making stuff ourselves.
And Ivan, I don't know if you got the invitation, but I got invited to Tampa, Florida to have personal meals made by the famous Dr. Nabert. Next slide.
I did not get invited. I'm very sad right now.
So oils you should cook with. They should be oils that don't oxidize when they're heated, such as avocado oil and coconut oil. Olive oil is good for salads, but not for heating and cooking. Next slide.
Shouldn't be frying that much anyway.
So exercise is key to most things in life, but you don't have to exercise for 2 hours like Dr. Walks does. You can break that up into 10 to 15 minute periods a day so you don't kill yourself and sweat up all your clothes so your wife has to take them to the laundry. You should quit smoking and should not be around people who smoke or let them in your house. And after 20 minutes of quitting smoking, already your blood sugar, your blood pressure starts to go down, your heart rate returns to normal. So you can see an immediate reduction when you stop smoking. Next slide. So getting enough rest makes you less likely to crave sugar, fatty foods that provide quick energy. You don't need to turn yourself into a pretzel to meditate. Find positions that are comfortable. You don't have to be a guru or whatever those people who meditate in India. Just find a quiet corner and reduce your mental activity and pressure. A few minutes of meditation each day can create a positive influence on well-being. Is that true, Dr. Walks?
That is true, Dr. Maxey.
Good. And do not overlook your emotional and mental health if you need to manage stress, anxiety, depression, or grief. Sometimes you need to talk to somebody and let it out. Holding it in is not going to help at all. Being the strong, stiff upper lip, big he-man, big she-woman, you got to reduce that stress, reduce that grief. And if I'm right, most grief, especially over death, is not about who died, but about how it affects you. So it's sort of selfish anyway. So we got to find a way to control it. Next slide.
So that was a review of what we've talked about. We want to talk a little bit more about how dangerous stroke is. And it can ruin not only the rest of your day, but the rest of your life. The rest of your life. So we want to be careful about stroke. And the heating thing that we want to heed is make sure you move promptly. Is there anything in the chat or questions that we should address, Dr. Walks and Dr. Hines?
While we are reviewing some of the comments in the chat, there is an acronym that I just want to bring to the group's attention. The acronym is FAST, right? And it is an acronym for stroke that is meant to address. F would be if you have any facial drooping. The A is around arm weakness, but it could really be arm or leg weakness. And then the S is around speech changes, slurring of your words, difficulty finding words, that type of thing. And T is for time, meaning it's time to call.
Well, thank you to my co-hosts, Dr. Neighbor Stevens, Dr. Walks, and Dr. Hines. We're almost at the top of the hour. Are there anything that we should address in the chat? Any questions, any comments before we go? I just want to emphasize how important stroke avoidance, high blood pressure avoidance is, and we still know that there's a danger of problems that happen with COVID-19 and the various types of other viruses that are out here, the flu, the bird flu, etc. Simon, can you see the chat? Anything we should know about? Dr. Steiner, is everything okay on the East Coast? Minnesota?
Okay, here we are. We're having tornadoes coming through right now, so I had to run away for a minute. So I don't know if I missed the part you might have addressed aspirin use, Dr. Maxey, and whether we should be taking it every day or not anymore.
No,
And
it's something that probably should not be taken, but you had to check with your health provider on that. But there have been some new guidelines on that, and there's some new risk factors with it. And there's also some fact that it may help you avoid colon cancer. So you got to do a risk benefit analysis. I'm glad you brought that up.
thank you. And we're having a actual tornado watch right now. If a warning, and if you look at the state of New Hampshire and Vermont right now, you will see tornadoes blowing through us right as we're talking.
Do they normally come up there?
Almost never, rarely, but we had one a year or two ago, a real bad one that just missed us by maybe 2 miles. And now we have one that may be headed right for us. So we're buckled down, to say the least. Okay.
Okay. Well, very good. Any other quick comments? I'm going to wish everybody a very good Sunday afternoon. Enjoy yourself. Enjoy your family. Hug your kids and your wife. Our friend. Thank you very much, Simon. Have a great day.